A series of defibrillating shocks is usually programmed in the VF zone. Various characteristics of the shock waveform, shock vector, shock amplitudes, and number of shocks delivered determine the success of defibrillation and may or may not be programmable. In the VF zone, you can program the device to deliver a sequence of up to 6 defibrillation therapies, each with specific energy and pathway settings. The number of shocks must be limited in order to avoid a disastrous situation during the delivery of a series of inappropriate therapies. The shock waveform is not programmable in Medtronic devices. After a long history of monophasic configuration, the biphasic shock waveforms, which lower the defibrillation thresholds, has been introduced. The waveform is always biphasic and cannot be changed. The current pathway for the high voltage pulse is reversed midway through the pulse delivery. In the first phase, current is delivered until the pulse decays by 50% of its original voltage. The device then truncates the phase and reverses the current pathway for the second phase. This corresponds to what we call a tilt 50-50. The programming of the first shock energy in the VF zone is a compromise. A less than maximum energy shock might terminate VF after a short charge time. However, should it be unsuccessful, the second shock would be delivered after a long overall duration of VF. The programming of an immediately high energy shock is more likely to terminate VF, but at the cost of a longer initial charge time. In clinical practice, the strength of the first shock is programmed either at the maximum capacity of the device or at a strength 10 joules lower than the maximal capacity of the device, or even sometimes at a lower strength tested during the implant procedure with the aim to terminate the tachyarrhythmia with an appropriate safety margin and without wasting energy. It is important to know that in the last recommendation, the maximal energy is recommended for all the shocks. The following shocks, so shocks from 2 to 6, are usually programmed with a maximum energy value. Two shock polarities can be programmed. A nanodal shock corresponds to a shock with the right ventricular electrode as the anode in the first phase of a biphasic shock and as the cathodes in the second phase. In contrast, a cathodal shock corresponds to a shock with the right ventricular electrodes as the cathode in the first phase of a biphasic shock and as the anode in the second phase. The setting for the pathway parameters in Medtronic devices are AX to B and B to AX. AX refers to the active CAN and SVC coil electrodes, which may be used individually or in combinations. B refers to the RV coil electrodes. So the pathway setting defines direction of current flow during the initial segments of the biphasic waveform. If the parameter is set to AX to B, current flows from the active CAN and SVC coil to the RV coil, so this is a cathodal shock. If the pathway is set to B to AX, this current flow is reversed, so this is a nanodal shock. You can program differently the polarity for each of the 6 shocks that you will deliver. There is another parameter that you can program, which is the shock vector. The programming of this parameter depends on the number of shocking electrodes available. Single coil shocks are delivered between the distal coil of the right ventricular lead and the CAN, while dual coil shocks can be delivered between the distal coil, the proximal coil, and the pulse generator. Here, this is an example of single coil lead, so you need to program SVC off since there is no coil in the SVC, and the shock will be delivered between the distal coil inside the right ventricle and the can. If you have implanted a dual coil lead, then you can decide to include the SVC coil in the shock vector. With a dual coil, you can also decide to program it like a single coil lead. There is a third option. You can program the can off. This is what we call the configuration called can. In this configuration, you will deliver the shocks between the two coils. So of course there is a warning because this is possible only with a dual coil lead. It will not work, of course, with a single coil lead.